were our corona warriors who helped their fellow citizens. They offered health care and services, ran ambulances, delivered medical oxygen to the needy, operated child support programs, performed the last rites of the deceased, and supported the state in coping with the crisis. I am delighted that we are awarding the selfless work of this legion of unsung heroes. However, there's a light after the darkness. India has reported less than 50,000 daily cases for 92 consecutive days. Now with only 26,727 cases, new cases added yesterday. Moreover, the weekly test positivity rate, which WHO recommends being less than 5%, has been less than 3% in India for 94 days. And Delhi has seen less than 100 positive cases for 3 months now. Consequently, hospital beds for COVID have very low occupancy in major cities. In Kerala, a state with the highest number of active cases, only 4% of all those admitted in hospital had critical symptoms. The second wave finally seems to be behind us, but we cannot be complacent. We can be complacent only at our own peril. We need to keep our guard up by continuing to maintain social distancing norms and masking up. We also have much to celebrate. India's vaccination program has been one of the most significant global success stories of the battle against the pandemic. After a slow start, we have gone on to launch one of the world's most extensive vaccination drives. Since March 1st, we have given over 900 million doses of COVID vaccines. This is more than the population of Europe. In just one day, on September 17th, we vaccinated over 25 million people across the country, a world record. Besides being the largest manufacturer of vaccines globally, India has developed the world's first DNA vaccine, which can be administered to all people above the age of 12. The Prime Minister recently informed the UN General Assembly of this. Honorable Minister Mansook Mandaviya told us recently how India aims to resume the export of COVID-19 vaccines from this month, thereby fulfilling our global commitments. Honorable Minister, we have chosen the winners of the Healthgiri Awards through online public nominations. 5 or 6 names were shortlisted for each of the 18 categories. The jury selected the winners and verified them by an independent research agency, MDRA. A select jury comprising of Mr. Manish Sabharwal, Chairman, Team Lease Services Limited, Dr. Srinath Reddy, President, Public Health Foundation of India, Dr. Naresh Trayan, Chairman and Managing Director of Medanta, Dr. Swati Piramal, Vice Chairperson, Piramal Group, and myself. I want to thank our jury for having taken the time out to do this. I just want to mention that we decided not to consider those awarded the previous year, although they continue to do exemplary work. I believe that the winners today and those who participated in the Healthgiri Awards are the true heroes and the real champions of New India. It is our privilege to recognize their outstanding work. I'd now like to introduce Shri Mansukh Mandaviya, the Honorable Minister of Health and Family Welfare, Chemicals and Fertilizers. Shri Mandaviya is a member of the Rajya Sabha from Gujarat and one of our youngest cabinet ministers. He was sworn in as a Minister of State for Road, Transport and Highways, Shipping and Chemicals and Fertilizers in 2016. In 2019, he was given independent charge of the Ministry of Ports, Shipping and Waterways. He represented India in the World Economic Forum at Davos, Switzerland last January. An ardent propagator of feminine hygiene and women's rights. He was awarded Men for Menstruation by UNICEF on the Menstrual Hygiene Day for his initiative of Savida Sanitary Napkin. In July this year, he was appointed Minister of Health and Family Welfare, where, among other tasks, he has to lead the government's fight against the pandemic. Sri Mandaviya is a passionate cyclist and one of our few politicians to ride a bicycle into Parliament. Asked why he does it, he said, "It's a passion, not fashion for me."